Hi, everybody. This is Dr. Stanley, your pregnancy specialist. I just wanted to quickly pop on here and talk a little bit about diabetes. It seems to be a word that has a disassociation with high glucose levels, and let me tell you why. I've had more than a few encounters with fellow souls, women who are trying to get pregnant are actually coming to me for advice, called preconceptual counseling, and they're sharing with me that they've had some glucose levels that have been high, which have caused whatever their provider or doctor to put them on some of these new injectables. But when I use the word diabetes, they're not owning that. So here, let me tell you something, loves. If you have persistently high glucose levels that are not associated with, like, say, steroid use, and it is sufficiently high enough that the provider or the doctor that's taking care of you wants to put you on medication or has put you on medication, I know we don't like labels, but you do have diabetes. And so, with that diagnosis in mind, it is not a wise idea to try and get pregnant until those numbers are better, those glucose numbers. Now, we want your fastings to be under 100, and we want your 1 hour after meals to be under 140. We're not looking for perfection, we're looking for a trend, and we like for that trend to be 80% within normal range. Why? Because you can have a high risk of miscarriage, not to mention the fact you may have difficulty getting pregnant. There's a high risk of malformations to the baby. There's a high risk of the baby getting big, called macrosomia. And lest you think that our mid schoolers who are 200 pounds are just like that because they're greedy. Let me tell you something. The long-term health effects to uncontrolled diabetes during a pregnancy, that's the end result there. Middle schoolers who are over 200 pounds with hypertension and diabetes themselves. So it's a label that might not sit well with our hearts and our souls because we don't want that diagnosis. However, it is a label that will help you achieve what you want and give you good long-term health so that you can scream at your kids later on in life because you're around to scream at them. All right? Take care, walk good, and I'll drop something in here another time. All right? Have a good one.